going. So first of all, I want to welcome everybody to what is the third of our events in celebration of Rare Disease Week. And as people will know, Rare Disease Day is this year on a Saturday, this Saturday, February the 28th. So we have in the Southeast Genomic Medicine Service put together a series of events in celebration of Rare Disease Week. And so I should introduce myself. I'm Frances Elmsley. I'm a clinical geneticist at St George's, and I am the clinical director for the Southeast Genomic Medicine Service Alliance. And today I'm really pleased to welcome Diana Spracci, I hope I've said that correctly, Diana, who is not only a GP, but she is mother to Sebastian, who has a condition now known as Shine syndrome. And Diana is going to talk to us a little bit about her journey with Sebbie, her son, through to diagnosis, but also to tell us a little bit more about Shine syndrome, and what sort of has happened after the diagnosis. And I'm going to chip in the middle just to give the clinician's perspective. But now I'm going to hand over to you, Diana. Thank you very much.
Thank you. Good morning, everyone. Yes, my name is Diana. I'm a GP, but today I'm here more as a mother. And I want to share the story of my son, Sebastian, and our 10-year journey with Shine syndrome. And bear with me, this is both a professional story, but also a very personal one, about listening, about persistence, about rare disease parents, and about partnership. So let's start. So Sebastian was born at 39 weeks and 2 days. He had a normal 12 and 20 week scan. He was born by venous delivery. But overall, everything seemed fine. On paper, it was a completely normal start. But from the beginning, something felt a bit different. He was struggling to latch. I remember we finger fed him in the first few days using a finger and a tiny NG tube. He posited constantly in the first 6 months. He gained weight, but feeding was difficult. He was unsettled, irritable at the feet, and he was extremely sensitive to high-pitched noises, to the point where we often had to remove him from the environment because nothing could soothe him. And yet he was a baby who loved music. Musical instruments would completely captivate him. So at that stage, nothing was dramatic, just small things, subtle things. The kind of things that make you question yourself as a new parent, and he was our first child. By the age of 9 months, I could see that sitting up was a challenge for him. His motor skills were delayed. He was lacking core muscle strength. And I remember thinking something isn't right here. I was training to be a GP at the time, and leaving him at nursery was quite traumatic. He was always falling backwards, hitting his head. He couldn't crawl. The other children were running around him, and he couldn't keep up with them. We were all very miserable. So we asked the GP to refer us for an assessment, and that was the beginning of our investigation journey. At the age of 20 months, he was diagnosed with global developmental delay. He was showing significant delay in all the areas. And that label explained what was happening, but it didn't tell us why it was happening. Then we were offered this group therapy session called Little Steps in Ashted. It was an hour a week. Though Sebastian couldn't tolerate these sessions, the sensory overload of a group therapy was overwhelming for him. So then we went privately. We decided to go privately. We did physiotherapy, occupational therapy, speech and language therapy. Over the years, we tried different others: music, animal, prompt therapy, hydrotherapy. But most importantly, we were supported by this portage service. A wonderful woman called Celia came to our home for play therapy. She arrived each week with a bag full of carefully chosen toys and her endless patience. She was deeply passionate about early development, and she didn't just work with Sebastian, she taught me how to play with him in a way that could support his development. For those of you who have little children, and you might know Miss Rachel, Celia was our Miss Rachel about 10 years ago. So she also guided us through the EACP process. She helped us secure Sebastian's special needs school. So he started at school just before his third birthday, and he's still there, fully enjoying it every day. He's doing swimming sessions every week, horse riding with the RDA team. But sadly, at the moment, both Portage and Little Steps do no longer exist. In those early years, though, their support was vital for our family. So now I would like to take you with us on Sebastian's walking journey, from the 12 months old when he couldn't sit independently to his first steps at 2 years and 3 months. So I've put together a 5-minute video, if that's okay. You will probably hear us speaking in our native language, so please forgive that. But I hope you see what this year meant to us. It took 12 months of focused work, of repetition, physio, encouragement, very small, almost invisible gains. But the day he finally walked was one of the proudest moments of my life. So let's have a look at it together. Thank you. Thank you for watching this with me. Let me try and go back now to our meeting. Right. So despite this big developmental progress, some things unexpected happened. The effort of learning to walk was so intense that his body seemed to forget how to make sounds. He lost his vocalizations. And even now, at the age of 10 years old, he remains non-verbal. Sebastian has had his first MRI scan at the age of 2 years and 7 months. This showed dilatation of the lateral ventricles. When we look back at the antenatal scans, his ventricles had been at the upper limit of normal, but that was something that hadn't seemed significant at the time. Sometimes mild ventricular enlargement resolves on its own, and sometimes it progresses. And in Sebastian's case, it appeared that it progressed. But even then, we still didn't have an answer. We only had more pieces of the puzzle. 1 month later, we had our first genetics appointment. I remember it very clearly. For the first time, I felt that someone was really listening, you know. Up until then, we had often heard it's just developmental delay. And while that may have been factually correct, it never answered the question of why. So Dr. Emsley found Sebastian clinically intriguing. And more importantly, she stayed curious. So I'll hand over to her now so she can tell you her side of the story, if that's okay.
Of course.
Thank
You, Diana. Do you want to move on? Yes. And
Yeah.
just move on through to the next one. So I also remember meeting Sebastian, which is quite unusual because I see quite a lot of people, but he must have had a sort of overarching effect on me. So he was about 2 years, 9 months when I met him first. And as you have heard, there was a history of a normal pregnancy, but then these early difficulties with feeding, which is, quite a common story for children with developmental delay. And there was much more evidence at that time of motor delay. So he'd crawled late, he'd walked late. And when I saw him, and I've just looked back at my notes from that day, just this morning, he had some occasional words with meaning, but not anything at the level of a 2 year, 9 month old at that time. Importantly, he hadn't had any seizures. And there were no other sort of specific factors in the history. I didn't think he was unusual looking. His growth parameters were all within the normal range. But what I found about him was that he seemed to have very hypermobile in his lower limbs in particular. He hyperextended at his knees. And you may have noticed as he sort of got going with his walking, he tended to keep his legs quite straight, and he had quite a waddling gait when I saw him. And I thought he was very unsteady given that he was 2 years, 9 months old. So it was sort of adding up to some concern. And I looked in my notes that I wasn't 100% sure that there was going to be an underlying genetic cause, but I thought he warranted investigation. So I went back, and what we commonly do is review MRI brain scans with our neuroradiology colleagues, and Diana has just been through the findings that he had this asymmetric ventricular dilatation, which is a very non-specific finding. It doesn't really give us any clues as to diagnosis. We find this quite commonly in children with developmental delay. I think he'd had a CGH array before he came to me, but
Yes.
I requested, and that was normal. I requested Fragile X testing because he had a relatively big head compared with his body, but it was all within the normal range. And I also requested Angelman syndrome, which is actually going to be very unlikely because of the normal head size. But I was thinking of, things that we could present with developmental delay. And then I reviewed him, I think about 6 months later. He was making progress. His walking was much better, but there were clearly ongoing concerns. And I made a note at that time that I was concerned about a possible diagnosis of autism and did mention this to the paediatrician and suggested an assessment for that. We, as I've outlined before, we were very fortunate at having access to whole exome sequencing at that time, which was not available widely across the NHS. We're talking in 2019 at this point. And so I was able to refer him for whole exome sequencing, specifically saying that could the lab look for causes of intellectual disability. So that's what they did. And I'm going to hand back to Diana now for the results of that.
Thank you very much. Yes, at 3 years and 8 months, we received the diagnosis. I remember that moment very well. And I remember my heart was racing as I was reading the letter. Sebastian has Shine syndrome. It is caused by a mutation in the DLG4 gene. He's one of around 250 known individuals worldwide. So I quickly looked it up, and surprisingly, at that time in 2019, I found a community of people on Facebook, and they all had children similar to Sebastian. It was a scary and a brilliant moment at the same time, but suddenly I felt I wasn't alone anymore. So I'll tell you a bit more about this DLG4 gene. It is located on chromosome 17. It is usually autosomal dominant, and most often it is de novo. It encodes a protein called post-synaptic density 95. It's purple on the image. And this protein is critical in the postsynaptic excitatory neurons. It is essential for synaptic signaling, plasticity, learning, memory, and brain development. The PSD95 has 5 domains. It is the most important protein in the postsynaptic complex, and it acts as a scaffolding protein. It anchors multiple other proteins in close proximity. So when this protein is disrupted, synaptic communication is affected, and this explains the findings in Shine syndrome, and now we have an ICD-10 code for it, which we are very proud of. So Shine syndrome stands for sleep disturbance, hypotonia, intellectual disability, neurological symptoms, and epilepsy. And this is not just an acronym for me. I used to enjoy memorizing acronyms at medical school, but this one represents our reality every single day. So did diagnosis help us? This is the question we're often asked. There's no cure, so did it actually help finding out? Yes, it did change everything for us. It gave us, first of all, emotional validation. And clinically, we knew what to watch for epilepsy, for sleep disturbances, for developmental regression, signaling the possibility of sleep epilepsy. We now have available a medical care consideration plan for clinicians. And it also helped us practically. We could we could plan for educational support for his EHCP. We could do financial planning. The diagnosis also helped shaping our family as well. So we knew Sebastian's genetic change was de novo. It hadn't been inherited from either of us, which meant the recurrence risk was low. But low doesn't mean zero. We had met families with 2 children affected by DLG4, and this was thought to be likely due to mosaicism. So this was not a theoretical risk. It felt very real to us. And I knew very honestly that I could not cope with 2 children with Shine syndrome. So after a lot of thought, we decided to try for another baby. And with the help of Dr. Emsley, we had antenatal CBS testing. And now Daniel is 3 years old. He's typically developing. And watching both of them together is incredibly moving. They do have their own kind of quiet connection. And also something beautiful happened. So Daniel has gently desensitized Sebastian to these high-pitched noises. So where there once meltdowns, there are now mostly smiles. So yes, it did him well. Because we have a name now, we can look at research. So we took part in the first natural history study in 2021. We now have gene therapy discussions in the US. We have our first open clinical trial based on omega-3 fatty acids in Canada. And last year we had our first international conference uniting researchers from around the world. So overall, I think diagnosis did not change Sebastian, but it did change everything around him. So we're very thankful for that. So Sebbie is now 10. His sleep is extremely unpredictable. He's often awake at 2 a.m. I guess he taught us to take one day at a time. He has the developmental capacity of a 2-year-old. Remains nonverbal and his muscle tone is still low. He is learning to communicate using an AAC device. But despite this, he's a very happy boy. He loves school, he loves music and sound books. His favorite musicians are Ed Sheeran, George Ezra. He has very good taste. He loves spas and a very good foot massage. He loves hugs and kisses, car trips, walking, but most importantly, he brings joy to our house. So this is why we continue fighting. Our current challenges now include hypersalivation and reflux, poor weight gain, disturbed sleep, abnormal breathing patterns, toilet training difficulties, impulsivity, wandering, not being aware of danger, possible partial seizures, and learning AAC communication. So yeah, it's still quite challenging, despite of being 10. Currently, there's no research in the UK about DLG4. We are planning to establish a UK charity for DLG families, DLG4 families. We want to create a register, a UK register. We want to connect our families, increase clinician awareness, and stimulate research interest. I would like to say that actually this changed me as a doctor. So this journey changed how I practice medicine as well. It didn't only change me as a mother, but it changed me as a doctor. So before Sebastian, I understood rare disease intellectually, but now I also understand it emotionally. I tend to listen differently now. And when a parent says something isn't right, I take their concern seriously. I trust parental instinct more deeply. And I understand how traumatic dismissal can be. I just want to share that rare disease parents are not just difficult parents. They are navigating uncertainty every single day. So what rare disease parents need from you, even if you have never seen the conditions before, please listen, try to be curious, help coordinate care, try to connect families to support networks, be willing to research, be partners, and not just providers. We need you to walk beside us. Sebastian may never speak, but his life has taught me more about medicine than any textbook ever did. he has told me that listening is a clinical skill, that validation is therapeutic, and that rare does not mean insignificant. If you remember one thing from today, let it be this: walk beside your rare disease families, because for them this is lifelong. Thank you. Thank you very much for listening.
Thank you very much, Diana. That was really powerful. You can see by the number of hearts and claps that you are getting that people were obviously very affected by that story. And I think that, you know, it's particularly wonderful that you're able to bring this back to you as a doctor as well, and what this has taught you. I am going to open this out to questions. So if people have got questions for Diana, and you will already know that you can see that Diana knows quite a lot about DLG4 and quite a lot more than I do. But if you have got questions about the genetics or about Sebbie, please do put them in the chat. And there's a very nice comment from Colette, who is the lead nurse for genomics at NHS England, just saying something very similar to the effect of this on you as a clinician. So I just have one question, Diana, and this is not really a question, it's more a sort of point for discussion, I think. It was that, you know, Genetic Alliance, of course, are doing a lot of work and have done a lot of work on rare disease, and there are various different organizations now really trying to work hard on raising awareness of rare disease. And Genetic Alliance have actually sort of recently done a survey of families with rare disease, which was covered in The Guardian a couple of days ago. I haven't actually found the results of the survey, but essentially what it demonstrates is that we may be inching towards making things better for people with rare disease. We've had action plans, we've had, you know, all sorts of things, but we're not there yet. Can you think as a GP sort of sitting at that end of things, you know, GPs are often the first people that people with rare, you know, children with rare disease might end up with. Are there things specific for GPs that we should be focusing on to increase awareness of rare disease?
Yes, I think obviously GPs need to know a bit more about rare diseases, because they are the first line, and they are the ones that are picking up things. It's not just parents. It's the doctors as well that do their health check, their children health checks, and also the health visitors. Definitely having more resources for GPs would be beneficial. I think for us, it took about 9 months to flag it up to the GP. I think the health visitor assessment didn't raise any concerns, though I had some concerns at the time. It's important to increase awareness around the first line kind of clinicians regarding what is normal development, pick up on subtle things, and obviously take parents' concerns into account.
Yes, I think, very good point. And I should have mentioned that, you know, health visitors as well, sort of thinking about primary care, who are the first people that a child tends to meet in their lives, and it's raising awareness amongst those healthcare professionals that I think we still need to do. Colette has a question. She said, Diana, I'd really welcome hearing your thoughts on the benefits of the newborn generation study to identify babies with a rare disease in the asymptomatic stage. And I don't know, Diana, how much you know about the generation study, but it's a study of 100,000 newborn babies, babies sort of recruited during a pregnancy, and therefore they're then born and they are completely asymptomatic at the time. And the generation study is doing a suite of, well, it's doing whole genome sequencing, but only focusing down on particular conditions. So DLG4 would not be one of them, because the conditions they're aiming to discover are those that would have an early treatment, such as spinal muscular atrophy, which actually Nikki's just put in the chat. We're having a session on Friday. Do you have any specific thoughts about the generation study and that sort of pre-symptomatic testing?
No, I haven't heard of it, but I think that's an amazing idea. Obviously, even with Sebastian, there were some such a signs and the 20-week scan with the ventricles being at the upper level of normal. So these kind of subtle things we need to work up with our clinicians to try and pick up on them as early as possible. So yes, definitely that study it sounds amazing to me. Yes, I would definitely welcome that if I would have the chance. So definitely.
Thank you. Another question in the chat from Francesca, who's a consultant geneticist at Guy's Hospital. She says, thank you for sharing your personal experience with us. Do you think that implementing the Red Book to help health visitors and GPs to recognise some red flags might help? I understand there is a consideration for changing it towards digitalisation.
Yes, we do get the Red Books a lot in primary care. So parents bring it with them at their appointments, at their vaccinations, at their 8-week baby checks. So yes, that'll be. I think that'll be a good way of introducing change, and I think keeping it on paper might be a better idea than having it online. Yes, that's questionable, but I think I still I'm a bit old-fashioned in that area, so I prefer having tangible things in front of me. But yes, definitely the Red Book might be a good way of introducing that.
Yeah, thank you. Yeah, because there are a couple of initiatives. The first is there is a company which is actually partly run by a GP called Mendelian that have been using AI to look for red flags in GP records, and using this sort of the combination of red flags they've been able to sort of consider potential diagnoses for those individuals. That's been just part of a pilot program that's been running more in the north of England. But the second thing is also Medics for Rare Disease, which I think is an amazing charity as well, did a survey a couple of years ago looking at lots of people with rare disease and what were the sort of red flags that came out as the potential for a rare disease diagnosis. And so they put those together in a very nice publication in Orphanet in 2024 as well. So I think there probably would be a good place. I have to say I don't know who oversees the Red Book. Do you know, Diana? Who could we talk to about doing something along those lines?
I can find out. I'm not aware at the moment, but there's hopefully a way to get to who's producing it, isn't it? And we can talk to them for sure.
Yeah, thank you. Oh, look, so Ruth is a health visitor and midwife. Fantastic. Thank you, Ruth, for joining us. And it says, although Red Books around the country are all different, a page for child and family medical history will be really helpful near the front for any significant events and test results. I'd also like it to stay on paper. But I also noticed that Colette has put up her hand. I think, Colette, you might be muted. I don't know. Nikki, are we able to unmute Colette just to say a quick word?
She is
Oh, yeah, you
amazing.
are. If you unmute yourself now, Colette.
Thank you. Just to say, Francis, that the
ownership, as it were, of the content of the Red Book is a joint venture between the Royal College of Paediatrics and Child Health, but the actual commissioning of it sits within the NHS England vaccine screening team, because obviously all of the information that goes off to the Child Health team then needs to come across into the Red Book and so on and so forth. So changing the content, this is something that we've tried over many years to get it as robust as possible, and it's not as simple as you'd like to think it should be. And I know that the topic around digitalisation has gone round and round the houses for a number of years, with all of the risks and benefits of both paper and digital. I don't know where they've got to currently, but I can always put you in touch with the relevant folks if that would be of any help.
That would be great. Yes, we do have quite good influence at the Royal College of Paediatrics and Child Health. We have a fantastic sort of genomics connection person, Ellie Hay, who's a consultant at Great Ormond Street. But if you've got direct connection, Colette, that would be fantastic. So let's put that on our agenda.
Okay, I'll do that for the NHSE team, because that would be something I can do very easily for you. I'll loop you into them.
Thank you. We'll see where we get to. You know, I think if Diana's on the case, we might get quite far.
Oh, thank you. No.
All right. So Francesca says there is already a digital version of the Red Book, but maybe that's staying around for a bit. Anyway. Okay. I'm not seeing any other questions, so I think we can wrap the session up. But amazing, Diana, you had almost 150 people coming to talk to us today, to talk to you today, you talk to them. And just thank you very much again for sharing your story.
No, thank you. Thank you for listening. It was a great opportunity for me to share my story, and hope we will continue to be partners in the journey.
Absolutely. All right, thanks a lot, and everybody look out for our other events coming. Another talk on Friday, and people at St George's, we have the Grand Round tomorrow talking about rare diseases. All right, bye for now.
Thank you, Diana.
Thank you. That was good. Thank you.
That's great. I love seeing all the photos of Sebbie. It's brilliant. It was very nice. I'll send you the recording afterwards.
Lovely. Okay, perfect. Have a lovely afternoon.
You too, but let me know if you need anything else, won't you?
Okay, yes. Perfect.
Okay, lovely. Thanks so much. Take care.
Bye-bye.
Bye.